Mr. Jackson is laying at the foot of the bed, and where are you situated with the EKG machine and your position? May I have the lights, please, Mr. Seo?
Thank you.
Okay. Again, with the patient right here, the feet right here, the EKG machine is right here, and I'm standing right here.
May the record reflect the witness is indicating the side of the bed closest to the door and at the foot of the bed. So you are located at Mr. Jackson's feet area, correct?
That's correct.
Where is paramedic Blunt located at this time?
He's at the other end at the head of the patient.
May the record reflect the witness is indicating the area at the far side of the foot of the bed, between the foot of the bed and the red chair on the left side of the photograph.
Fair enough?
Fair enough, sir.
Thank you.
And there's still activity such that every one of the rescue team is performing a task. For example, is someone performing CPR?
Yes.
Chest compressions?
Yes.
You are focused on the capnography reading and the EKG readings, correct?
Yes.
Paramedic Blunt is at the head of Mr. Jackson, and he is taking care of air and breath management, correct?
Yes.
Now, are you also tasked with communicating with a hospital base station, conveying information from the field to another party?
Yes, I am.
Describe that for me, please.
After we did the initial treatment of the patient, the first round of drugs, we find out what the rhythm is, we find out our basic information, our basic history. I called UCLA Hospital to report to them.
Did you call by radio or cell phone?
I used a cell phone.
Who did you speak to when you reached the UCLA base station?
At the UCLA base station, there's a nurse that's monitoring. I spoke to the nurse there.
And when you spoke to the nurse, what information are you conveying and why?
I'm conveying to them the age of the patient, the condition of the patient, specifically how long the downtime is, what we've seen, what we've done, and all of this because it's going to influence how the patient's treated, treatment-wise, what's next.
When you advise the base station of this information, do they then process that information and give you feedback as to what steps, if any, you should take next?
Yes, they do.
So you are in communication with the radio nurse. Is the radio nurse then in communication with doctors at the base station?
Yes, of course.
Mr. Senneff, when you are tending to Mr. Jackson, you indicated that the time of the call and the patient's side rendering care at 12:26, roughly 5 minutes, did not comport with the patient just having had this episode, correct?
Yes, that's true.
What observations specifically did you make that led you to feel as if there was inconsistent information that you had received with your observations?
Yes, there were multiple observations.
Describe them, please.
When I first moved the patient, his skin was very cool to the touch. When I took a first glance at him, his eyes were open, they were dry, and his pupils were dilated. When I hooked up the EKG machine, it was flatline, asystole, and the capnography reading was low. It was only 16.
Was a set of starter drugs, the drugs to start the heart, administered to Mr. Jackson?
Yes, that's correct. An additional epinephrine and additional atropine.
Was that second round of drugs administered the same way or a different way than the first round?
It was a different way.
Did you locate a vein in the jugular on Mr. Jackson's body in order to administer the second round of starter drugs?
I did, the left external jugular.
Prior to
Indicating where on the body, please.
Thank you, Your Honor. Mr. Senneff, would you please indicate what you mean by the left jugular, and may the record reflect the witness is indicating the left side of his neck area between his shoulder and ear?
Thank you.
Mr. Senneff, prior to you locating the jugular vein in Mr. Jackson's neck area, did one of your team members attempt to locate a vein to administer the starter drugs in another location of Mr. Jackson's body?
Yes, that's correct.
Describe who did that and what they did, please.
Paramedic Mark Goodwin was attempting to get an IV in one of the arms.
Was he successful?
No.
How many attempts did you see approximately Paramedic Goodwin make in attempting to locate a vein?
I saw him work on both the right and left arms. I think about 5 attempts.
And he was using a needle, correct?
Yes.
And he was successful or unsuccessful at locating a vein in Mr. Jackson's left or right arm?
He was unsuccessful.
Mr. Senneff, is it more difficult to locate a vein in a body when the person's blood has not been circulating for a period of time?
It's significantly more difficult.
And the lapse of time, 10, 15 minutes, would make a difference in terms of circulation of blood and ability to successfully locate a vein?
I'm not sure about that.
But a period of time where circulation has not occurred is a significant factor in an ability to locate a vein, correct?
I don't know. I honestly don't know if there's a difference between 5 minutes or 15 minutes.
But you just indicated, unless I misunderstood you, that a period of time would have an effect on the ability to successfully locate a vein. Is that accurate?
Yes.
You indicated that you were in contact with UCLA base station and you were apprising them of the treatment that's being rendered and the results of the treatment, correct?
That's correct.
When you were speaking with the base station, did they provide you with feedback regarding what you should do concerning his care?
Yes, they did.
What did they say?
After the initial contact, and I explained to them what we had, what we were doing, they asked what we'd like to do, meaning do we want to continue resuscitating the patient or do we just want to stop at that point?
And what was your response?
We wanted to continue.
At this point in time, you have administered how many rounds of starter drugs into Mr. Jackson's body?
When I first made contact with him, we had 1 round on board, and that's when... And then we had 2 rounds on board, and then we discussed it again.
At the point when you administered 1 round of starter drugs and reported back to base station, was there any change in Mr. Jackson's condition from your time of arrival until you update UCLA with his condition?
No change at all.
And then at a later point in the treatment, after the first round, you are conveying his condition again, correct?
That's correct.
Had there been any change in Mr. Jackson's condition at this point?
No change.
So you're speaking with UCLA and you're speaking to a doctor through the nurse, correct?
Yes.
And you're advising the base station that there's been no change, so you have no heart activity, no change in respiration, no other changes in Mr. Jackson's condition, and upon conveying that information, they in turn ask you, what do you want to do, correct?
That's correct.
Was it UCLA's information conveyed to you that they were prepared to cease efforts to resuscitate Mr. Jackson?
Yes, that's correct.
And the reason for cessation of efforts would be that essentially Mr. Jackson was dead. Is that correct?
That's correct.
At some point during your attempts to administer starter drugs, was the IV site that you identified in Mr. Jackson's leg compromised in some way?
Yes, it was.
Describe how that happened, please.
Our starter kit was open, and the medications that we use for cardiac arrest are laying there on top. And Dr. Murray had retrieved medications and was using the IV port in the leg.
And then what happened?
In doing so, he pulled the IV out of the leg.
And at that point, do you then go to the jugular and attempt to locate a vein there so that the mission of administering the starter drugs can be accomplished?
That's correct.
And were there any successful results as a result of the administration of the second round of starter drugs?
No, there was no change in the patient's status.
At some point during the care provided to Mr. Jackson, does someone indicate that they feel a pulse in the body of Mr. Jackson?
Yes.
Was that information conveyed or after UCLA advised that they were prepared to pronounce death?
I'm not sure. It's there because initially UCLA asked what we would like to do. We said we'd go with it. And then they asked again later. It was before. The pulse was checked before the last time they asked us.
Very well. And who was it in the room who identified that they felt a pulse?
Dr. Murray.
And at what part of Mr. Jackson's body did the defendant indicate that he felt a pulse?
The right femoral pulse.
And would you describe for us, please, where the right femoral region of the body is?
That would be in your groin, the right side of your groin, top of your leg.
What did you do in response to Dr. Murray's proclamation that he felt a pulse?
First thing I did was I looked at the heart monitor and see if there was a cardiac rhythm that could create a pulse.
And what, if anything, did you see on that cardiac monitor?
I saw what appeared to be a flat line with CPR going on.
Describe what you mean by that, Mr. Senneff.
They're the leads that are attached to the patient, the wires that are attached, they get moved in the process of doing CPR, and when they move, they make a mark on the heart monitor.
Is that referred to as PEA or pulseless electrical activity?
No, ma'am. That would be artifact.
I understand. So the movement generated by the compressions is what caused any movement that you observed on the cardiac machine?
That was my belief.
Did you also take any other measures to confirm whether or not Mr. Jackson actually had a pulse?
Yes,
That, please.
I told my crew to continue ventilations to stop CPR.
And continued ventilations means that the assistance of breath from Mr. Jackson would continue, but the compressions, the up and down motion on Mr. Jackson's chest would cease, correct?
That's correct.
And what was your determination once those requests or orders were followed?
The monitor, the heart monitor, it was a clean, flat line.
And what does that mean to you, Mr. Senneff?
It means the heart was not functioning electrically. And
Basically, that means no heart.
Wait, the witness was saying, and?
Oh, I'm sorry.
Okay.
That means it was not functioning electrically, so I didn't feel that there could be a pulse. I then checked for a pulse myself, and also one of the other firefighters checked for a pulse.
What were the results of your checking for a pulse?
I did not feel one at all.
Did you attempt to feel the pulse in the same area of the femoral area that Dr. Murray claimed he felt a pulse?
Yes, I did.
And did you say that another individual of your rescue team also attempted to verify that Mr. Jackson had a pulse?
Yes, that's true.
Who was that?
I believe it was paramedic Blunt.
And did you receive any affirmative or positive information from any other member of your team that they felt a pulse?
No, I did not.
turning again to the exhibit marked People's Number 43. I'd like to turn to that again for a moment and